Dear students, as part of your upcoming R3 submission, you are required to record a brief verbal interpretation of your client's results of Rotter's incomplete sentences. This recording is to be made as if you were providing feedback directly to your client, not explaining the report to me as your instructor. The purpose of this task is to help you develop the ability to communicate psychological findings clearly, ethically, and empathetically, skills essential for all assessment professionals. Please follow the guidelines below carefully. First, regarding perspective and tone. Speak as though you are explaining the results to your client in a supportive, respectful, and professional manner. Avoid technical jargon. Use clear, simple language that communicates meaning accurately without overwhelming the listener. Next, let's discuss the structure and content. Your recording should follow this general structure. Begin with an introduction and orientation lasting 10 to 15 seconds. Briefly introduce the purpose of the session by saying, "I'd like to share with you what your responses suggest about how you may be feeling and coping with different areas of life." Then, move to the overall adjustment score, which should take 30 to 40 seconds. Report your client's overall adjustment score, both raw and categorized, and explain what this score means in everyday terms. If the score indicates adjustment, describe what that typically looks like. If borderline or maladjusted, briefly describe the likely areas of strain or dissatisfaction. If the score is adjusted, comment on the person's coping strengths. If maladjusted, explain gently which areas appear to be most affected. Next is thematic interpretation, which should be 1 to 2 minutes long. Summarize the main recurring themes found in the client's responses. You may refer to up to 3 themes drawn from the 6 domains discussed in class, such as self, others, feelings, thinking, stress and coping, and context. Provide brief, coherent interpretations of what these themes may reflect in the client's emotions, needs, or attitudes. For example, your responses about family suggest a strong sense of loyalty and a desire for harmony, though there may also be some frustration about meeting expectations. Finally, conclude with an integrative summary and closure, lasting 30 to 40 seconds. End with a concise summary integrating the overall findings and emphasize strengths as identified from the evaluation on an ending note. Now, for the recording guidelines. The length of your recording should be 2 to 3 minutes. Speak naturally. Do not read from a prepared script, though you may keep brief notes. Record in a quiet environment with clear audio quality. Save and upload your recording in MP3 or MP4 format on MS Teams.